promoting businesses and organizations to help them reach their full potential. Lighten the path to the success of your business. Enhancing the lives of our listeners by talking about things that matters most. Helping you to shine your light emotionally, mentally, spiritually, socially, and physically. Spreading positive vibes. You've got it locked and you're listening to Light Vibrations, brought to you by Lyte Communications right here on CBN Radio 90.9 FM. And now your host and our director, Natasha Letza.
Hello, you've got it locked and you're listening to Light Vibrations, powered by CBN Radio 90.9 FM and brought to you by Lyte Communications every Wednesday at 8 a.m. I'm your host, director of Lyte Communications, Natasha Letza. Today, our program is being sponsored by the Ministry of Health and Social Development, and our conversation is about tobacco control in the BVI. Here to give us some perspective on the topic is focal point for NCDs and Health Promotions Coordinator, Ms. Ivy George. Ms. George, welcome to the program.
Thank you for having me.
The pleasure is mine, Ms. George. Now, tobacco use and regulation in the BVI. Start us off and tell us what you want us to know regarding tobacco use and the regulation.
The first thing I want you to know is that tobacco use and control under chronic non-communicable diseases, there are 4 behavioral risk factors, and one of them is the use of tobacco and secondhand smoke. Mm-hmm. And so coming out of the high-level meeting in the United Nations, they recommended as one of the recommendations as a best buy for helping to control NCD is the introduction of legislation, if you don't have it already, on tobacco control, and also further stress that countries who have not yet signed on to the WHO or the World Health Organization Framework Convention on Tobacco Control need to work towards that.
Okay, so Ms. George, do we have any tobacco control legislation? And if so, what are some of the salient points you want to talk about today?
For us, we have been very fortunate in that we have had tobacco products control regulations since 2006, and we have an act called Tobacco Product Control Act. And the salient points in that act deals with packaging, advertising, promotion, and distribution. That's part 1. Part 2 deals with defining a public place, prohibition of smoking in public places. It talks about the importance of smoking signs. And then we have a miscellaneous section which deals with who is a tobacco officer, offenses, and then we talk about the regulations.
Well, tobacco control is definitely a topic I know of vexing one here in the community because, a lot of people really don't know what are our rights in terms of non-smokers when it comes to people smoking in and around establishments. Okay, so you mentioned, the packaging and advertising, and then you also mentioned, smoking in public places. Before we get to the hot topic of the smoking in public places and some of the issues surrounding that, I'm talking a little bit about the advertisement and, what are the do's and don'ts when it comes to packaging and the advertisement of tobacco products.
That's an important area, and actually one of the reason we were last week, was supposed to have a big meeting on the whole issue of tobacco, the FCTC, and also mention about our regulation, is as we move towards becoming a part of the World Health Organization, FTC, the convention, some of these things one of the important things that we need to get right away has to do with the advertising and promotion. However, it's a very complicated in the fact that apart from, for example, you're not supposed to advertise at point of sale. So that's one of the point in terms. You're not supposed to advertise on radio, internet, none of those sources. Where it get complicated was, I remember when we were doing our review to see what kind of standing we were in, they were also saying to us that if we have products like, for example, magazines, and so that comes from outside, I'm not sure if many magazines still advertise tobacco products. Then if we are allowing those kind of magazine, or for example, if we hear broadcasts from other places that allow people to advertise, then we will not consider to have a full ban on tobacco control in terms of advertising. And there's supposed to be no promotion. You can't put out. I remember not too long ago we had to deal with an institution that put out on the internet pictures of smoking, so we had to deal with that. That is not allowed.
And I guess from my perception, being a layperson in the community, my question would be, do we really have a problem with smoking here in the territory? Are citizens, smoking, and do you really have trouble with businesses complying with that no advertisement ban as it relates to tobacco products?
Well, the older generation didn't smoke as much, but we do have a number of persons who live among us that come from places where smoking is a big problem, is a norm. And so we have those people come in among us and they have smoking, and we also have tourists that smoke. And what we are also noticing that the trend in the younger generation, I don't know if they're mixing in the cigarettes with weed or what, but we are noticing that there are increase in younger person who are smoking.
Wow.
So that is a problem. And when we did the STEP survey, which was back in 2009, we didn't have a high score on people smoking, but we did have a high score on the number of persons who said that they were exposed to secondhand smoke.
I know that a couple years back, the Ministry of Health, had a lot of promotion going out with regards to being a smoke-free island, and there were various posters and so erected, basically targeting persons coming to our shores, educating them about our smoking laws and what we would like as a community as it relates to smoking. Can you speak a little bit to that, and what type of impact that had on persons smoking locally? When we developed our
Tobacco Act, we were one of the first people in the Eastern Caribbean to have a complete ban in terms of tobacco smoking in public places. But since then there have been some changes, so we will not be able to boast that we are now 100% smoke free. However, we did make people aware, because it's a good thing to do to make people aware, because that we had a regulation and that smoking was not permitted in public places, indoor. Now, this is where there's a big problem too. Like, people will say to me that, they see people smoking along the road. The WHO Convention for Tobacco Control speak to smoking in public places and indoor public places, indoor workplaces, and then to some public places that are outdoor, that has things like the sporting arena, recreation ground, like during festival, etc., etc. That is what the convention speak to. But people I know, we went as far as saying no smoking on the beaches. But in terms of WHO, now they are no smoking on the beaches for another purpose. That has to do with the number of butts that are being dropped in the sand. That was a different matter. That had nothing to do with this. But we can't tell people don't if you're walking along the road. We did say that in our law, which again too is something that we need to revisit. We said 30, I think it was 30 feet outside of the front. But here is a very small place, and as soon as you get outside and you start to count, you're into another business place. So that was one of the issues that we are in the process of amending our regulation and our Control Act, and these are some of the things that we need to address going forward, because we want the law to be something that is implementable. But if you have a lot of complications, then it becomes difficult.
And I know everybody, if they want to smoke, they have the right to smoke, wearing all things that smoking brings. But, to non-smokers and being in environments where there are people smoking, that usually is a big turn off for me. Where if I'm in the vicinity of cigarette smoke, it immediately irritates me. I have to basically look all around the room to figure out who is the culprit smoking. And if I'm in an establishment, what protection do I have, or what role would, business managers and owners play to ensure that other patrons that, frequent their establishments are complying with this, and not basically inconveniencing other persons there and in the same establishment with all of this smoke.
Well, I'm glad you bring that question up, because one of the things that one of our limitations under our present act is that we said that if a person is found smoking in an establishment, that person will be fined. However, there were no penalties for the owner or the supervisor who was on duty and saw someone smoking, but ignore it, because they were not going to be penalized. So definitely that is one of the things that will be corrected under the amendment, that now proprietors or supervisors and duty will know that they have a responsibility. They must make sure that they have signs up. They shouldn't have any ashtrays or anything on the table or anything like that. And they must not allow. You can't turn a blind eye to someone smoking. It is now their responsibility to ensure that they let people know that you cannot smoke in this establishment.
And on behalf of persons who do smoke, is there any room in the legislation that would be able to provide an outlet for smokers when they go out, in terms of, sometimes you go to hotels and they say, okay, this is the smoking area, or this is the non-smoking area. Are we going to look at the legislation in that regard, where we will allow spaces for persons to smoke?
I remember the last time when this legislation was coming into being. That was one of the things a lot of the restaurants and so were trying to do. However, if we are following WHO guideline, and if we are now seeking to sign on, that those are issues which they don't allow for smoking spaces, etc., because they're saying there's really no way that you can safely have a space and have the smoke container. so these are things that we will have, there will be more discussion about. But, sharing your lower a table, stuff like that, no, it doesn't allow for that.
And I guess I'm going back a little bit to my original question with, non-smoker being disturbed by smoke and, speaking with management and management not doing anything about the smoker that's in the vicinity. Then what recourse would we have? What is the next step? Should we call the police? What level of intervention can we have after that?
Well, as I said, right now, some people would inform us. We have had many complaints from the public that they went to such and such an establishment and what had happened. We have written many letters pointing out to them about the area and so forth. But again, like I said, we did not have a fine for the proprietor, so a lot of places they did not enforce it. And so this time around, that is something that will be, and we will also have to look carefully in the ministry as to how we will be able to monitor this situation a little bit better.
And you keep mentioning you're mentioning your affiliation with the WHO Framework Convention on Tobacco Control. Share with us a little bit about its mission and objective, and how do you see being a part of this convention benefiting BVI and improving the regulations?
Well, the World Health Framework Convention for Tobacco Control was entered into force on February 27, 2005. It is one of the most widely adopted treaty in the United Nations system, and the FTC is a legal binding treaty that requires countries bound by the treaty or parties to implement evidence-based measures to reduce tobacco use and the exposure to tobacco smoke. So right now there are 180 parties to this convention as of August 2017. And this is very important. A number of countries, so sometimes when people come here and try to break our laws or our regulation, some of them are coming from countries that have these very same regulations as it outlined. And with the impact of chronic non-communicable diseases, they are pushing very hard at the World Health Organization, from recommendation from the UN, from recommendation from CARICOM, that countries who have not yet signed on, they're encouraging us to do so. Originally, we were under, because of we are territory, and so we were under the UK. They were seen as part of under what the UK, because the UK is a signatory to this treaty. However, for the last year and a half, we have been working with Public Health England, and the mission of that particular project was to help the overseas territories to come to a place where we can sign on. So we've been working with them, and we are still working with them to be able to meet the requirement. And the first three of them that are very important, which are, I think, Article 8, Article 11, and Article 13. Article 8 deals with the business of smoking in public smoking in public places. 11 deals with advertising and promoting of and marketing tobacco products, and the other one deals with the packaging. And this is something too that I need to mention here, because when we did our legislation, we just said that you needed to have a sign. We would accept tobacco, cigarettes, and what that came once you had a little sign on the package warning people.
Mm-hmm.
Well, since that time, there have been a lot of work that has gone into this particular bit about the packaging, and what they are now requiring that on the packages you should have up to 50% of the packaging should now include graphic warning messages about smoking.
Mm-hmm.
And so we don't manufacture, but we will have to now put in a clause which says that effective such and such a year, to give people time who have those other cigarettes to get rid of them, but effective so and so, you will not be able to bring into the country cigarettes that does not meet that requirement.
Mm-hmm. So when would the BVI actually sign as a part of this convention? When are you going to jump on board with that? And basically, how do you see that collaboration, enhancing our regulations locally, and if any education or training would that be afforded to BVI as part of the framework or as part of the convention?
Yes, because in terms of, we will have to then make clear to person what are these articles under the convention. Now, some of them will not be relevant to us, but I know to start with, those are the first three that we need to get sorted out, and we have both the government have given the permission for the amendment of the regulation and the act, and have also given the permission for us to sign on. So, right, that is in the process. So the next step will be to get our act, get our regulation and act up to date, and then see what the next steps are. What this also, one of the reasons we were having the meeting, because a lot of time, once it's health, people just leave things up to health. But it is not only, it's this, if you're looking at it, we need to look at this as a all of society, all of government approach. And there are other agencies in government that has a role to play. For example, like the what comes into the country. So customs will have an important role to play. The police will have an important role to play. Trade, when people are opening new businesses and so will have an important role to play. The hospital or the authority in terms of providing smoking cessation opportunities for those who are smoking and need to quit. Education, to educate our young people coming on stream, and of course the Ministry of Health. So it's a multi-agent approach, and we all will need to understand what our roles are and come to a consensus of how this is to be done. I know one of the things that people often complain about is the enforcement. However, in a lot of places, civil society play a major role in helping to make tobacco legislation effective, because a lot of times you're advocating, that it's important for you, what are the benefits for your children, for yourself, and so forth. But we have a very passive civil society, to me, have not been very aggressive in helping to champion causes yes, they do get involved in some areas, but in a lot of these international agents, in terms of best practices and so forth, I somehow, a lot of them, we don't get that type of support that we need. Mm-hmm. For example, Jamaica, when they were doing their tobacco control law, I think it's the Heart and Stroke Foundation that really drove that. In another Caribbean country, the Cancer Society played a very important role in terms of helping to get the legislation and the act passed and to make sure that it's enforced, etc. So I would, make an appeal to persons who have who are concerned about this particular issue to come forward and say, how can I help?
Well, definitely, Ms. George, and we know if anyone could pull together multi-agencies is you. So we want to, wish you well on this endeavor, as you seek to, basically pool all the resources to ensure that, whatever tobacco regulations and rules and laws we come up with are in plain language, are enforceable, and have the buy-in from all needed essential persons. And Ms. George, I can't believe this half hour has wound down so quickly, but in this last couple of minutes now, I'll give you an opportunity to basically seal up the program and mention any key things that we left out.
As I mentioned before, that tobacco is one of the behavioral risk factors that we need to be trying to control to help to control chronic non-communicable diseases. This is one of the behavioral risk factors, and these behavioral risk factors, when they are not checked, they give rise to biological risk factors, which are things like diabetes, high blood pressure, cancers, etc. And then the end result that what we are seeing is a great increase in cardiovascular diseases, strokes, attacks, and also kidney failure. And these are preventable. 80% of the chronic diseases that are plaguing us are preventable. So if we can walk upstream and really encourage people to change lifestyle. I know just changing lifestyle alone, we have to put things in place in terms of the environment and other areas, but it's not a health matter, something for the Ministry of Health. We have to have multi-sectorial collaboration. We have to have an all of society approach. And I was Yesterday I was involved with a virtual meeting at CARICOM with the Ministers of Trade and the Ministers of Health. And we have come a long way, but we need to be more intentional, because just talking is not going to do. We really need to have adhere to a systematic way of moving this situation forward. So I'm just asking for the cooperation of everyone. The place is small enough. We can do it.
We can and we will, Ms. George. We can and we will. I want to thank you for coming on the program to speak to us about tobacco regulations in the BVI. We encourage our listening community not to smoke, but if you do, please be considerate to others and smoke away from persons who may be affected by your secondhand smoke. Say no to smoking as we continue our quest towards a healthier Virgin Islands. You've been listening to Lyte Vibrations, and I'm your host, Natasha Latsum. Thank you for tuning in, and blessings.
You've been listening to Lyte Vibrations, brought to you by Lyte Communications. Lyte Communications, your one-stop shop for all of your communications and marketing needs. From conception to completion, we offer the entire communication Communications package. Choose Lyte for reach, results, and reliability. We have over 15 years experience and we offer an array of services guaranteed to enhance your reach and increase your market presence. To showcase your business or organization on our program, contact Natasha Letzum at natasha@lytecommunications.com or via WhatsApp or telephone at 284-545-7355 to secure your package today. Community-minded individuals with knowledge in finance, health, business, relationships, spirituality, fitness, agriculture, healthy living, parenting, or any other topic that can enhance the lives of our community are also encouraged to contact Ms. Letzum to organize an interview. Thank you for tuning in to Lyte Vibration, and don't forget to tune in this time next week as we continue to bring you life-changing information. Until next time, shine your light.